Right, so what we're going to do is for the rest of the morning, we're going to actually get a chance just to come together and practice some of what we've done. So Emily's going to help us here in a minute to just break out into three groups, into three breakout sessions. And what I'm hoping that everybody will do is I want your group to come up with one public health topic that you would like to educate your elected officials about. And I've got a list of questions here that I really want you to think about as you prepare that educational or advocacy campaign for your officials. So what elected officials will you target with your education? In what forum will you provide that education? And how will you go about setting up the forum? What educational materials will you utilize to prepare and possibly to leave with them? Will you include anyone else in your educational session or forum? And if you will, who will those partners be? And then what we're going to do is at the end of a 30-minute breakout, we're going to come back together, and I want each group to have a spokesperson, or if you want to, tag team on that, that's totally fine. But I want you to report out on what your educational topic was or your campaign was, and then the kind of those considerations to each of these bullet points here. Let's just go back and summarize then, and I don't care what order we go in here, but we'll take about 5 minutes per group to just summarize, give us the highlight of what your topic was, and then the answer to all of these questions on the screen or those considerations that you took into account. So is there a group that wants to go first?
I can go first. I think I was in breakout room 1, but so our group, our topic, we discussed how to help those that are in the foster care system. And as they age and phase out, they no longer receive care. So they're on their own for things like rent and food, and they don't have a lot of support. So we decided that we would target the governors, or our governor, DPHHS, those in Medicaid, and also people that are working on insurance, legislators that are more focused on insurance and things like apprenticeship and workforce. And so we would target those officials. And for our forum, we wanted partners that are familiar with the foster care system. They could be parents or those that were in foster care or just passionate about the subject. The local CPS would be a great partner in the work group. And we wanted representation from the Medicaid population. So it'd be nice to have the voices of the single mothers, those with disabilities and low income. And also we would want people that would work with behavioral health individuals or those with the substance abuse and use treatment. And then we would have a forum where we would kind of have this work group and make sure that everyone has like talking points and things to present to these elected officials. And we didn't think that infographics and data could cover our topic. So we were thinking more of the stories to really bring our points in, but also hit on the economic and system issues that are being faced. And then we would also work with these groups, the speakers in these that are presenting. So those that are in that population, they would also do the advocacy piece. So we would hope that they would share their stories to hopefully get some statewide change in a legislative session. And if anyone in my group wanted more to add, feel free to jump in, but that pretty much covers it for our group.
Did anybody want to add to group 1? And Elise did a great job of capturing all that.
Thanks.
All right. Well, thanks Group 1 for brainstorming together on an important topic. So let's move on. We'll hear from one of the other groups, whoever wants to volunteer.
I can go. I also thought I was Group 1, so I have no idea.
We'll all be Group 1. We're all number
we're
1.
all number 1. So we were talking about marijuana, and since it's recently legalized from the state perspective, we were also talking about how do we approach elected officials to determine regulation to limit number of dispensaries within city or county limits. And so the elected officials were definitely talking about, like, you know, from the top down is legislators, and it's, I guess no one necessarily knew what the laws were currently, but I had just come from the perspective, I was in California when it was legalized there, so it was just like per city could make the decision for allowing dispensaries or not, which those laws were like associated but not directly dependent on if medical marijuana dispensaries were already available. So this is strictly just talking about recreational. So we were talking about pretty high up, and then it's also like what programs, you know, we're questioning what programs will be leading that public education. Is the state going to pair it with tobacco and not whatnot? So just wondering if there will be a limit to local authority, or if it is locally dependent, like that local education, those elected officials, you know, your mayor, your county supervisor, city council, city health officials. And then in the forum, it was definitely multifaceted as far as who the elected official was, but being ready to share information in multiple ways. And we really liked from this perspective of how you guys used the panel of experts and having stories and opportunities for public to share stories, and having a Q&A where you just like having the expert panel will definitely, we thought, eliminates misinformation, which I think is really important, especially for something like introducing something as big as legalizing marijuana. So yeah, it's hard to identify who needs to receive the education until we answer some of those previous questions. But obviously, like from this perspective, you need to think on a local level and approaching like who your community is, who your population is, because you want to know what information you need to collect for health outcomes. And then we talked about educational materials is definitely because there is definitely a lack of education in a lot of ways, just based on the research. So it's sticking to known facts and knowing your source, and like really knowing that your source is credible, and pulling stories from other communities and states that have previously legalized, just to know, you know, have previously established stories of positive and negative outcomes. And then we were talking about an important voice to include in these educational sessions and forums are youth. And we had a couple people from tobacco programs, and they said like that's always an important perspective. So that's our summary.
Great. You guys do a good job of taking into account a lot of considerations. And I really like the idea of having that expert panel with some questions, answers, because I think that really gets some of the answers that your community is mostly going to need. And, you know, they're people who show up at the table, their voices are going to be heard that way. So good job.
I hope the state does that early on here.
Well, maybe it's everybody on this call today could reach out to their elected officials and suggest that.
Okay, that's a good idea.
It's good practice. Perfect. So last but not least, the final group number 1, I guess.
Great. All right. So, hold on. I'm having trouble getting back to my notes. I'm sorry. Oh, there we go. Okay. So we decided to address, we wanted to talk about state funding for pre-K. So some of the things that we were thinking about would be, you know, statewide legislators who, you know, who recently or do have young children. Those might be the kind of the early adopters. Those with experience in business or, you know, being an employer. Also those with experience in education would also be good to reach out to. And then we also talked about engaging our local boards of health, as well as our superintendent of schools, especially Elsie Arnston. And so in terms of the forum that we would provide our education, we talked about doing virtual town halls, where we would have experts talking about early childhood and development, that we would invite officials and then directors of Head Start. We also talked about, you know, how to create, you know, excitement and to have other people advocate for this for us. And so reaching out to local businesses or entities and maybe being a part of their annual meetings or professional development and really talking about the advantages of, you know, having pre-K, like state funding for pre-K. And also, you know, being involved in like teacher education and counselor training, again, kind of bringing information about what our initiative is and why it would be important for them to advocate for it. We also talked about, you know, having the teacher unions also pushing for some of this. And then we also talked about having radio ads, kind of television ads, as well as kind of newspaper ads and articles about this. Educational materials, we talked about having kind of infographics about how this initiative can really affect our economic development and show how you know, having you know, state-funded pre-K could really benefit businesses, how, you know, early investment is the most valuable use of their money, that early intervention can reduce substance use and, you know, likelihood of incarceration. And then we would also be, you know, utilizing experts in the field, as well as using people with lived experience, where we were thinking about creating like local, creating like short videos. And so, and then we also talked about, you know, including, you know, local chamber of commerces, you know, people in the education system, superintendents. So.
Great. You guys had a really broad list of partners, and I think we're really thoughtful about who to engage, how to engage them, and thinking about, you know, reaching out to those legislators that have sort of the background to be those early adopters. So your educators or those with small children, because, you know, why it's important, because I'm a legislator with a small child and this issue matters to me. So I think those are all really great recommendations, and also opened up the discussion to the community through your community forums, those virtual town hall meetings, to be sure that everybody could be part of the conversation with some clear direction that had been laid out prior to that. So great work. Okay, well, I think those were some great topics that came up. I know we had more than one in our group and it was hard to narrow down. So, you know, hopefully you can keep those other topics that you had in your mind for this part of the session and, you know, move forward locally with those issues. I know that there was some interest being discussed on that local Board of Health authority. And so, you know, that may be a conversation that continues through some of those groups that were listed earlier today. All right, so we're gonna get ready to move on to our second breakout activity. And in this portion of today, what we're gonna do is, it's really just some case studies. Oops, let me change my slide here. It's really just some case studies to have you read through. We'll go back into 3 separate groups. You'll each have a different case study scenario. And it's really just reading through that scenario of an effort to educate elected officials and thinking about, like, what went well, what would we maybe want to consider doing differently? What would be your recommendations back when we come together for others to hear?
Just to give a recap on the case study. So it's a public health nurse, and in her community, there's low vaccination rates for students, and a lot of them have religious exemptions on file, but there's a bill that's been introduced. And basically, if the head of the religious affiliation signs on to that form, the student doesn't have to receive a vaccination. So the public health nurse, the day before the bill is going to be heard, she sends a letter to her legislative representatives asking to vote in favor. And it's on her work email, his or her work email, and there aren't any details about why to vote in favor. It just says vote in favor. So our group discussed that nothing went well with this scenario, basically because there wasn't a lot of education involved. There weren't conversations beforehand. This was kind of like a rushed situation. And also, she is in that line of lobbying because she's sending that email on her work computer, voting in favor. She could have sent it on her personal device, on her iPhone or on her personal laptop off of work hours, and that would have been fine. But we thought that it would have been way better to have a more prepared approach. And within that, we were discussing to improve this situation, that there could have been more campaigns about this problem with increasing vaccinations, and also talking about the different partners that could be involved to educate. So that would be pediatricians, Best Beginnings coalitions, Board of Health members, and also having a naturopath doctor or some type of doctor to address those concerns for the parents that aren't necessarily for vaccinations because they have different beliefs. So we just thought more education could have occurred to improve this situation. And that's it.
Thanks, Elise. So if the other group that tackled this scenario wants to add anything to that, we'd love to hear from you.
Sure, this is Mackenzie. I was in group 2, and thanks, Elise, that covered a lot of what we talked about. We wanted to give the nurse kudos for at least trying. We felt that that was better than nothing. And to be more specific about the form letter, Nicole emphasized that form letters, legislators will get hundreds, if not thousands, of form letters. They are very non-specific. They don't really make it stand out. So if you were to submit something, there are many other opportunities to make your message stand out. The planning ahead, so as Elise said, it felt very rushed. Like there wasn't a lot of time to think about what you're submitting. We had a rebuttal to that saying, well, sometimes legislation is pushed last minute. So in that case, maybe taking the time to reach out to higher up, someone with a little more pull that could have maybe called the legislature's office and not just sent a form letter, knowing that that form letter will most likely not be read by 9 a.m. Or if the nurse had time, she could write a letter or go to the hearing and tell her own story or tell the facts at the hearing, or have someone else tell their story and the facts at the hearing for her. Send a group of people if she couldn't make it. And then just agreeing with Elise's group's idea to broaden the push for legislation. So don't just go through the public health alley, but reach out to other stakeholders, maybe church organizations, understand what their, if there is time, understand what their points are. Do the heads of the churches want to be signing these? Where do they lie? What churches or faith organizations or religious institutions are for this or against it? And so having both pro and con in your backpack so that you're able to rebut and answer questions if called upon.
Great, thanks, Mackenzie. All right, so we'll click down to our scenario 3 if that group wants to walk us through their findings.
So can you guys hear me?
We can.
Okay. So we were the public health professional your board of health does not support the Medicaid expansion, and they believe that it's a pretty poor use of the state resources and it's not contributing to your local economy. So you're attending a board of health meeting. We did like to note that the person or us going to the meeting had a lot of really great data and information and facts, and the resources where you got those facts from to back up your findings and your viewpoint, but that it might not have been necessarily delivered in the best way, just on a fact sheet that is pretty difficult for some people to connect with and have any feelings towards a fact sheet or even read it. So someone did mention that maybe preemptively sending out somewhat of a survey to find out what the Board of Health, each individual Board of Health member felt towards Medicaid, their viewpoints, what they knew or thought they knew as fact, so that when we came to the meeting, we might be able to address some of those issues or concerns and fact correct some people, because that can be pretty impactful when you change someone's viewpoint with facts. Another thing we kind of talked about, and guys correct me if I get this wrong, but maybe providing some of these facts that are listed out, not necessarily on a fact sheet or a document, but having livable cases and individuals being able to come in and explain how that individual fact applies to them or affects them. We had a lot of people kind of typing in the chat where having a rancher come in and explain how they lost their ranch that was severely positively impacting their economy by bringing in local produce and expenditures, how that rancher lost his ranch because he was injured once and he didn't have health insurance because he was, self-employed. So that severely negatively impacted the economy. And just kind of bringing in those different viewpoints of, one of the things is percentage of annual median family income and how much of that goes towards medical expenses. So having a family of 4 come in and explain how they spend their money in the economy, where they work, how they impact positively their economy, and then show how all of those, their full income, none of it can go to medical expenses because they are a pretty low income family, and how they do already impact the economy and they just need assistance with the medical expenses. And so that might help with that stigma. I know there's like that national stigma of Medicaid can be viewed as people leeching on the economy. So just changing that viewpoint. I think, oh, and then sorry, the other thing someone really wanted us to mention is bringing in hospital officials and talking about how, hospitals have to do a number of write-offs every year. So having a hospital official evaluate how much money they lose every year due to people not having insurance, and how much, if those individuals came in with Medicaid and they weren't doing as many write-offs, how much of that funding they can then put back into the hospital and improve wings, bring in new doctors, improve the economy, and how they can physically improve and use those Medicaid funds to positively impact the hospital itself. Guys, I don't know if there's anything else you wanted to add, but that's all I could think of off the top of my head.
Great job. So I'll bounce us back just really quick, hit the highlights since we didn't cover number one. I'm not going to go into it a lot, but basically this scenario, it's okay, Emily, don't have a pouty face. We're good. I'm not worried. This scenario is you as a local health department of public health professional travel to the nation's capital to participate in Hill Day. And basically when you get there, your senator that you were supposed to meet with is tied up in another unexpected meeting, and you meet with the staffer. And so the way you handle it is with some frustration and expression that, you know, it's kind of a waste of your time. You have this meeting set up, and you maybe didn't handle it as best as you could. So a couple of things that go well in this scenario are, one, you're at Hill Day, so that's really good that you're there to advocate for seatbelts was the issue, national mandatory seatbelt law. So it's good that you're taking this issue up the ladder into the nation's capital for a statewide seatbelt law. And it's good that you showed up and you did have an appointment. However, some things that could have improved were when you show up at to meet with your elected officials, it might not go as planned. They're really busy, and sometimes urgent matters come up that they just get pulled away from. And so know that in those situations, their staffers are really important partners with you. So don't be worried that you're speaking with the staffer. That's their job, to be sure to pass along relevant information and be your voice on behalf of your elected official. We didn't have leave behind materials prepared in this scenario, so that could have been improved. We also did not know the bill number. So making sure you know what bill number you're referencing is important. And finally, just, you know, hopefully something we don't have to talk a whole lot about, but just being kind to the staffers. They're there to be the right hand to the elected officials. They have a really important job, and they truly are your allies. So not feeling like you got left with somebody second to your senator in this scenario, but your voice will get passed along. So thank you guys for going through those scenarios. I hope that that is helpful to you. So we're in the home stretch. I know it's been a long morning to sit here and be engaged and keep thinking, but really what we're going to do is just open it up to whether there's some discussion or questions. And if I don't know the answer, I will certainly get back to you with an answer. But are there any questions on today's topic in the materials that we covered? So we've got a question here. Would it be wise to have a collective response to the new marijuana laws? And I know this is a question that's being discussed in a lot of different venues right now. And I do think voices coming together is always good, so that you're not just one sole voice trying to speak out. So, you know, finding out who else is working on this issue. I know that there are several groups that are really trying to dial in the details of what the new marijuana laws are, and where can you open dispensaries, and what will be local versus state level decisions to be made on where new dispensaries open. So I do think it's good to have a collective response, knowing that different people are going to come with different opinions. That's why we have these conversations. But finding your group that your opinions align with and really coming together with a joint message, I think, is valuable. Another comment that it was great hearing from elected officials, and I agree. You know, I just think that, you know, when I came into public health, I really ended up here a little bit by accident. And so when I first found myself, you know, in a position to speak with elected officials and to have an opinion that mattered, it was really intimidating. And, you know, just know that I really liked Kyle's just very blunt, like, ask your elected officials what they want, get to know them, don't be scared of them, just really have those upfront conversations when they come into office. And that's gonna first show to them that you're interested in having a partnership. And they really are so important in the work that you're doing. So having them as a team member to your work is important, to be able to reach out to them in an ongoing manner. So I'm glad that they were able to join us today. Lacey comments that she's long worked in the not-for-profit side of healthcare and now working for a government entity. Watching what I do is always top of mind. But what I learned today is I cannot use any government resources, but I am allowed as an individual doing it on my own time with my own resources, which is okay. And I think, Lacey, understanding that, you know, it is our role to educate, and being certain that it's okay with your organization, which it should be, to advocate, but it's that lobbying that often crosses the line. So providing science-based information to your elected officials is okay. That's public health doing their job. But you may not be able to go and ask them to vote in favor or against something. However, as you brought up here, it's always okay to do that on your own time, and just being careful about, you know, not representing your organization in any way when you do that. And I would encourage everybody to consider using their voice in that manner.
Mackenzie, did you have a question?
Yes, hi, Mackenzie. I'm not exactly sure how to articulate it, but so I'm the health educator for the Montana Disability and Health Program. We work with and for people with disability. And so thinking about advocacy and legislation regarding social justice and civil rights, and recognizing I am not a person with a disability, so I don't have that lived experience, and using that as an example, but other people, maybe also as a white person, and I don't have the lived experience of a person of color. How do you engage those communities in showing your support, but also you being a part of that lobbying advocacy effort, if that makes sense?
So wanting to know how to be part of the bigger conversation of the messaging, the creating of the message, is that what you're asking?
I think so, and I guess I feel that, and as I work for the state, so I know there's that line of advocacy versus lobbying, but I feel that I have experience where outside of my work I could lobby for certain groups of people, but I don't feel that I should be doing that alone. So not in the role that I play at my job, but personally, and then bringing in the people with lived experience.
Yeah, you know, Mackenzie, I think you bring up a good point here of, you know, even if you don't represent yourself of being from a particular organization, oftentimes there are elected officials who know, like, oh, Mackenzie, she's with such and such organization. And so they may take that comment, even though you didn't represent your agency, and there could be some negative consequences back. So I think it's always, you know, an area of caution that you just want to be careful to present. I am representing myself, but then is there a better voice that you work in partnership with to carry the message for you? Maybe, maybe not. And I think depending on what the issue is, and as we spent a lot of time today talking about, those groups are going to look a bit different. It might be one person, it might be a whole coalition, but who do you partner with to best carry your message if you're concerned that there could be negative consequences to your organization and your programming based on your personal opinion, just because they know you're with a certain organization? Does that make sense?
Yeah, thank you.
Yeah, so I think, you know, just really working with your partners, and as you have those conversations, is there a natural leader who bubbles up as being the messenger on behalf of that group?
Thanks.
Yeah, you bet. Thank you for the question. I see in here from Ellen, she wants to know what percentage of my advocacy time do I spend educating local officials versus state representatives, and how do I come to that ratio? And honestly, you know, I guess I don't have an answer. You know, in my past role at the health department, I felt like I spent a lot of time with the storytelling and making sure that anytime I was submitting a report back to the state or to a federal partner or some other funder, that I was really documenting our successes in that story. And so I think I spent a lot of time in that aspect of just making sure that reports aren't just numbers, but it's also kind of the real life implications of what the funding and what your program is doing. I would say probably I've spent more time advocating to state representatives, just because that's where so much of the funding was coming from, that, you know, I felt like those were the conversations that were top of my list. However, we certainly ran into some topics of discussion with our local Board of Health and our commissioners about how funds were being utilized. And people, if they don't understand your program, or like it was brought up earlier, people don't necessarily know what our health departments are doing or where we're located. And if we're not taking the time to let our local officials know, you know, as Jane said, they're making decisions all the time about how county funds are being used. So, you know, when I presented in our Board of Health meetings, I always tried to take an opportunity to share a story of impact. And it might have been really subtle, like they might have been hearing about it without knowing they were really hearing about it. But I think that every little window of opportunity you get to talk to your local or your state level or your national elected officials, and just drop those little tidbits along the way, I think that that's better than a huge campaign that you drop a ton of information on them in the moment. So, you know, try and make it an ongoing thing. And sorry, I don't have an answer to the actual percentages, but I think it really is going to depend on everybody's role, what they're doing, and how they're going to spend their time here.
I have a quick question for you, Holly, and it's piggybacking on what Mackenzie said, and this might have been what she was going for too, is let's say you're really passionate about something. I'll use the example of like Black Lives Matter. Yep. But like me, I'm a white girl. So even if I, you know, support their message, would it be better to talk to my educated officials? Should a person of color be our spokesperson versus me? Like, does that have an effect at that level of who the speaker or the mouthpiece is?
You know, I think yes. And I think that person can really represent the opinion of a larger group. Like, I think it's important to make sure that as that individual sending the message, that they're backed, like, hey, I'm part of this coalition and I'm the elected voice to share the work that we're doing. And I just think, you know, lived voice is always so experienced in the work that we do. And I don't feel like I can show up and have the best opinion about things that really don't impact me, or that don't personally affect me, such as maybe maybe I have a strong opinion about Medicaid and I'm not on Medicaid. I can see the implications, but somebody who's directly involved with that effort might be a better voice, but I think you don't want to have them have to go at it alone. You want to show that they're backed by a lot of other people and who those other people are and why it matters to your community.
Cool.
Does that help answer better?
Thank you.
Yeah, you bet. Any other questions from the group?
I'm going to slip a link into the chat, and it's to an evaluation survey. So just before you guys take off today, when Holly's officially done, just take it. Only takes a couple minutes. We use that information to build better trainings for you, and we pass that feedback back on to Holly. So certainly if you can take a moment to fill out that survey.
Thank you all. And then one last thing before maybe you do the survey, if you would just type one thing in the chat that you will do as a result of what you learned today, it would be great to know that hopefully you walked away with something that will change the way you operate in your public health role. You guys, thank you so much for 4 hours of your time. And thank you so much for the work that you do and being part of the public health system in Montana.